Want to step into the world of the rich and famous with the ultimate luxury lifestyle? Get a royal subscription to Beverly Hills Magazine today. Visit beverlyhillsmagazine.com now. Hello and welcome to the world's most famous podcast produced by Beverly Hills Magazine. I am Jacqueline Maddison. Today we are honored to have Dr. Hany Demian as our guest. His incredible journey from practicing medicine in Egypt to becoming the CEO of multiple successful organizations is an inspiring tale of innovation, leadership, and dedication to improving lives. He is the visionary behind Biospine Institute and Pain Care Clinics, two pioneering organizations revolutionizing pain management and spine care. In this interview, we delve into his career, groundbreaking advancements in medical technology, and his thoughts on the future of healthcare. Let's welcome him to the show. So let's welcome Mr. Demian to the show. Dr. Hany Demian, how are you? It's such a pleasure to see you this morning. Welcome to the show.
Thanks a lot for having me.
So let's dive right in. Your journey from a medical doctor in Egypt to being the CEO of multiple successful companies is remarkable. Congratulations on your success and hard work. Well done. Can you share some key moments in your experience that define this transition?
It's been a long journey. So let me give you make long story short. So when I graduated in Egypt, the market was oversaturated. I noticed that right away. Like we said, we used to say there are 2 doctors for each patient. So you can imagine it was very hard. So I quickly realized that, decided to have a fellowship in Columbus, Ohio, finished, couldn't get a job, didn't materialize in a job, unfortunately. And I decided to go back home. My cousin in Canada said, why don't you come for a visit? So I did, met friends, and they convinced me to stay. And Canada wouldn't give me my credentials back as a surgeon. So I decided, okay, let's jump into something else, like family practice. After 8 months, I couldn't take it anymore. I said, it's a little bit boring for me as a surgeon, so let's jump into something else. And by coincidence, I jumped into emergency medicine. I loved it so much, stayed there for almost 8 years doing emergency medicine. It was quite exciting. Then I wanted to have a change in my life. I got married. And my wife said, yeah, the night shifts are not really good for a newly married couple. So I decided, okay, fine, let's look for a 9-to-5 job. So I did, I switched to chronic pain management. This is when I met my mentor. And I did very well. And he decided, why don't we open our own clinic? Initially, I didn't want to do that. I was having a hard time with other business. So I refused, and he kept pushing. I decided, okay, if I come back and do another business, it will have to be 3 clinics. We started 3 clinics. We did very well within the first 6 months. So I said, why not make this a business, a company? And we started opening clinics and whatnot. During COVID, he decided to change gears and do something else. So I bought him out, and I decided, let's grow. So we grow into the US market. We acquired one of the largest platforms in spine, minimally invasive spine surgery, Biospine, and we almost tripled in size since then.
Wow, incredible. So kudos to you for having the courage to take over and expand the business. Now, these groundbreaking organizations, Biospine Institute and the Pain Care Clinics, now, can you explain their missions and how they complement each other, or are they separate?
They're separate but connected, in my opinion. So chronic pain started as a traditional pain clinic. Then we grew to be one of the largest group in Canada. We've got 50 pain specialists. We currently have 35% of the market share in Canada. So we decided to push the boundaries and add advanced pain procedures, regenerative medicine, and anti-aging. So we are the largest and the fastest growing in Canada. But we couldn't offer more than that for our patients. So we decided, what's the next level? I think we have to accompany our patients for their journey in pain. So that's why we acquired Biospine, which is a vertical integration. So when we finish or the patient couldn't add more to our patients, we send them to have their minimally invasive surgery. Biospine is a state-of-the-art. They've been pushing boundaries for 20 years, minimally invasive, and we recently added micro-invasive procedures. They are adding more and more regenerative medicine as well as a lot of state-of-the-art treatments for our patient, just to have a wholesome and a holistic approach for all our patients for their journey. And we decided to offer them the best. And this is why we actually acquired Biospine in Florida.
Excellent. So is the Florida location the first of your locations in the United States, or what's your presence in the United States currently?
Biospine has 7 locations. So we have 2 surgical centers, large surgical centers in Tampa and Orlando. We actually just got nominated last year, the top 1 and 2 surgical centers in Florida, and 1 and 2 in the top 15 surgical centers in the whole United States. One of
Wow.
our surgeons was nominated the top spine surgeon in Florida as well. So you can understand, yeah, it's been there for quite some time. They've been doing quite a bit of good work. We've got 7 locations between Tampa, Orlando, Sarasota, Fort Myers, Deltona, and Lakeland. And we're hoping to expand more in Florida, but our hope this year to expand beyond Florida to other states like Michigan and New York, some border states, to bring the connection together with the Canadian market as well as the US market.
Yeah, absolutely. I mean, chronic pain affects millions worldwide, unfortunately. So what inspired you to focus on pain management as a cornerstone of your business or your career?
Like you said, I looked at chronic pain initially when my mentor. Initially, I started as a job as I actually was good doing procedures. I enjoy doing procedure even while working in the ER, especially for chronic pain patients. Let you know that just 78% of ER visits are for pain.
Wow.
Yeah, half of those are for chronic pain. So
Mhm.
you can understand how many people or how many patients suffering from chronic pain. In Canada, there are 1 in 5 Canadian. In the States, there's actually 2 in every 8 patients suffering from chronic pain. So you can understand the magnitude. And the best part about it is very satisfying as a physician to take a patient through the journey of chronic pain from injury to recovery. It's just quite fascinating. And
Yeah.
it's really, yeah, when I was a surgeon, after the surgery, you see the patient a couple of times and that's it. In emergency medicine, you see the patient, you whatever you do, even you save their life, and you probably wouldn't see them again. But in
Right.
chronic pain, you actually build a relationship with the patient, and you see them through their journey. I have patients that I treat them. I treat their kids. I treat their grandkids. I have families here, generations. So you kind of build this community around chronic pain. So adding stuff like biospine or regenerative medicine is quite fascinating. That we'll be able to add more to them.
Yeah, and the Biospine Institute offers a revolutionary microscopic back surgery. Is that correct?
Yes.
So
Yes.
can you walk us through how this procedure works and its impact on patients? Because back
Absolutely.
pain is also very common chronic condition.
It is. It is. And let me explain to you the traditional spine surgery. So the traditional spine surgery, it's 3 to 4 hours. We usually have a 5 to 6 inch incision. We cut through the muscles, the bones to reach the area that we need to reach, and the patient is stuck at home recovering for 3 to 4 months. In microscopic, it's 15 minutes. It's 4 to 5 millimeter, and we don't cut any muscles or bones. We just separate them to get the area that we need to get to, and the patient back to work in 72 hours. So you can understand the significance of this. I personally call it the weekend procedure, right? Because you can have it on Friday, by Monday you could be back into the office, right? So what would you choose? I personally would like to have a weekend procedure. So
That is incredible. I mean, I'm in awe of that. If people knew that that was available to them, I mean, you'd have miles and miles of patients lining up. So that's incredible.
we are trying to spread that. We're trying to educate because patient
Exactly.
hears surgery. You know what I mean? We all, once we hear surgery, we're taken back. How much downtime? Can I afford it or not? We're going to make it affordable, and we're going to spread all over Florida and other states to make it available for as many patients as we can.
That's beautiful. So do all the physicians in your company know how to perform that, or you have those that have the specialty of that procedure?
All our surgeons are able to perform the procedure.
Okay.
It's a fairly new procedure. We use the scope that the orthopedic surgeon used in the shoulders and the knees. So this is as small as it is, and we're having great results. The pain after the surgery is quite minimal. Some patient wouldn't even take Tylenol after the surgery, so it's quite fascinating. Yeah,
Wow. Wow, you've
yeah,
discovered something. It's like a miracle. I mean, it is. That's
it is.
absolutely incredible.
It is. It's quite satisfying when you see a patient coming in a wheelchair and walking out after 15 minutes.
Wow. And that was, obviously one of my next questions would be, what is some of the most or the most rewarding part of your work? But I mean, it doesn't beat that. If you can take someone,
No, impossible.
yeah,
That's
I
yeah.
mean, you are changing people's lives. That's a
It
beautiful
is. It
thing.
is life-changing technology, and we're gonna keep pushing the boundaries for more, but it's quite satisfying.
Yes, absolutely. So now the healthcare industry is constantly evolving, and what trends or innovations do you believe will continue to shape the future of chronic pain management? I mean, obviously this procedure is one of them, but others with
I believe that chronic pain has a lot of, it's one of the youngest specialty around. So it has a lot of catch up to do. But chronic pain, spine surgery, as well as regenerative medicine will grow significantly in the next little while. We will be able to give the body the tools to heal itself. We will unlock the regenerative powers of the body to fix itself on a cellular level, tissue level, organ level, and we're not going to be only treating symptoms like pain, we'll be treating the cause of the problem. So there are groundbreaking research now in fixing DNA of the cell so the body can fix itself. And I think this will be the direction in the next few years. Add to this the AI, as we know, data mining is incredible. So looking back at what chronic pain achieved or spine surgery achieved, I think AI will have a significant role to play in having accurate diagnosis, accurate treatment, and really minimize any human errors.
that's incredible. You know, So I'm a Christian, and I believe God created the body in its natural form to be a self-healing biological machine. So with some of the advances that you're talking about to not only treat the consequences or the conditions, but prevent them in a way, is that
Yeah.
through traditional medicines like vitamins or um, procedures or natural methods? And then also you've mentioned AI, so technology. I'm just sort of fascinated. What do you think are going to be the primary preventative methods that the human body, as a biological machine, will be able to self heal?
I think the body's got the power itself. We looked at amino acids, we look at peptide and exosomes, which are extracted from the gastric juice in our body, and that usually uh, 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 unlock healing powers. As you might have heard about the Wolverine stack or whatever, which a lot of peptides that actually can fix tissues, can fix ligaments, tendons, bones, right? It
Yeah.
just only by enhancing the body. But it's not only this. I think stem cells will play a role. Right now, there's a lot of research about umbilical cord. So
Ooh.
when I had my first born, we saved his umbilical cord blood, right? This blood could be used for all of our family, not only for him. So we can take this DNA, we can extract it, we can with AI technology push it or unlock the capabilities of healing any one of us, especially cancers like leukemia and otherwise, right? So you can imagine it's just the healing is going to come from within. We just need to give the body the tools to be able to activate this. So I think there's a lot to learn, but the discoveries on a cellular level are incredible. What the body could do. We've been able to heal ligaments, muscles, ACL ligaments. We healed a couple with platelet-rich plasma, just putting the blood back, spinning it, and putting the regenerative cells back into the tissues. So it's quite incredible, and I think there will be a lot more coming in the next few years.
Oh, absolutely. From your mouth to God's ears. And then you mentioned AI. So, what role does technology such as robotics or AI play in the advancements of your practice, the Biospine Institute or the pain care clinics, just in general?
I
Where do
think
you see, yeah, AI playing the part?
I think AI will work mainly on data mining. So we'll see that you injured yourself a certain way, and then you were able to heal within a certain way. Then let's look in the cause or what happened that make you heal and make me wouldn't be able to heal. That's number one. Number two, we look at the surgeries or medication or supplements and how they affect the body, and we collect all this data. And at the end of it, I think we'll be able to help with a diagnosis. Right now, we realize that every individual is different. So the symptoms that you can come up with is totally different than what I have, right? And to be able to reach a certain diagnosis needs really an experienced physician skilled to do this. But if you can put all the symptoms in an AI machine and will be able to spit out the diagnosis, the treatment will be easy and will be more accurate and will avoid a lot of complication and long time waits for patient and will be able to predict really to 100% the capabilities of the treatments.
Oh, absolutely. I think AI will be a highly effective medical tool for that reason. Wow, that's incredible. So now, for someone who so deeply is involved in patient care, what is the biggest challenge that you face when dealing with patients with unusual conditions?
It's always a good challenge to have a different or a difficult case.
Mhm.
I think the most challenging is the generational challenge, which when I treat somebody in their 60s is different than their 50s, is different than their 40s. Younger generations are actually the most difficult because they're non-compliant for the treatment. They are very smart, very knowledgeable. They research everything, so I have to keep me on my toes most of the visit, really,
Yeah.
and they're very disciplined. Like the discipline is just quite amazing, and you can see this in all patterns of life, whether it's nutrition or whatnot. uh, but they're not looking for just a band-aid. They're not looking for a management. I cannot give them a pill and say you're gonna have this pill for the rest of your life.
Right.
They're not gonna accept it. Or you know what, I think I can do an injection for you, but you have to come back every 3 months for the rest of your life. That's not gonna happen,
Mhm.
right? So they look for something definite. They need fix. I need to fix this problem
Result. They want the results.
now. Yes.
Right now.
Yeah, now. I need to be fixed now. Can you give me an injection and fix me forever? I said, I wish I have that.
Right.
Right.
Yeah.
But
So sometimes
so
healing is a process and patience
it is, which
required.
I go home with these cases. I said, okay, I'll get you an answer. I go home and research and look for the newest and the most advanced technology, and I come back with a solution. So that's actually the most challenging patience for me, and I love it because it keeps me on my toes.
Yeah, absolutely. So what future advancements or expansions can we expect from Biospine or pain care clinics? Um, whether in treatments or any other innovations, maybe something you're working on.
We are working currently on robotics.
Ooh,
So yeah, we robotics are coming everywhere in medicine. And as you probably appreciate, they right now in orthopedics, you can do a full hip replacement by robotics while the surgeon standing in the room.
wow.
It's quite fascinating. So we are hoping to be able to apply this in biospine. In the chronic pain, we're doing a lot of research into peptides, exosomes, as well as regenerative medicine. We really would like to get to protocols because it's fairly new. It's like a cowboy land out there, but we would like to have the best and the most credible technology available for the patient. So we're working on this. We're working on genetic testing to match this with regenerative medicine. So I wouldn't even give you, okay, take this pill and it will help you heal. No, I will do genetic testing and see if it will actually help you heal this injury.
That's incredible.
It is. It's fascinating. It's quite exciting as well.
Yeah, I mean, you've accomplished so much. You work so hard. What advice would you give to other aspiring health professionals like yourself who want to open their own practice or combine clinical expertise with entrepreneurship like you have?
Uh, Learning.
Mm.
Learning, as I always say, learning is an obligation. It's not an invitation. You just need to keep learning. Whether if you're good with medicine, I think you should learn the business side. Unfortunately, we don't get to learn this in medical school. Um, that's why I had to go back and learn business. It's fascinating as well as the medical side. And believe in yourself.
Mm.
It just believe in yourself. And with hard work, I believe everything is possible. It's like I always tell my kids, it's the universal currency, hard work. It helped me when I was in Egypt, when I was in Canada, and it will help you anywhere you go.
It's so true. So true. So now with all your hard work and your dedication and commitment to your business and its growth, how do you personally balance the demands of success with your family life and your personal life? I mean, that's a challenge in itself as well. How do you do it?
It is quite a challenge, and I learned I learned this early on in my career through other mentors. But when I went to Harvard, I met a lot of CEOs, very successful CEOs, and the only advice is just let family comes first.
Mm.
It's very important. A lot of them missed out on this chance and ended up losing their family.
Right.
Said no success will outrun a family breakdown. So you have to look and get the family first. So we always have our family time. We go to church Sundays. We meet the grandparents and we go sports. We go dinners together. We travel twice a year together. So it's very important. And honestly, um, it's one of the most satisfying activities that I do in my day and in my week.
Oh, absolutely. I mean, there's no doubt that, business and career success requires sacrifices, but time with family and our personal fulfillment in love and in the relationships that matter, those are certainly not one of them.
Yeah.
So now community impact is also vital in healthcare, in really business in general. How do your clinics give back, or how do you personally give back to the communities that they serve? Philanthropic, altruistic initiatives, if
It's
any.
it Well, absolutely. It's actually cultural, religious, spiritual,
That's
and business wise.
yeah.
Giving back is one of the most satisfying that we do. So we have two charities, one in Canada and one in the US. We see patients. We actually have days that we do platelet-rich plasma in Canada for free
Oh,
for treatment. We see a lot of patients in, and we treat them for that cause. We participate in food banks around the communities that we're in. We have for medical students or medical students to be. We've got summer activities, and they can win significant amount that will help them in their school. We do have the same in Biospine. From each procedure that we do, there is a dedicated amount that goes for Biospine charity, mainly for kids that we donate to. But I would like to open it a little bit more, and I'm hoping to give back to outside North American as well. So we're looking into missions that we can actually go and help pain patients around.
yeah. I love that. That's incredible. And again, my faith, obviously, as a Christian, the Lord says, whoever lends to the poor, whoever gives to the poor, helps those in need, lends to the Lord, and He repays us. So for me,
Yep.
I support the God Foundation, and it supports orphanages and orphans all over the world. And I find the more I give, the more the Lord gives to me, the more my business flourishes. And it's not like I'm giving to get, but there's something very spiritual and very important about charity
Yes.
and that flow of giving to those in need, you know? It's
Yeah,
incredible.
it
So,
is.
yeah, what legacy do you hope to leave behind in the fields of healthcare and chronic pain management? I mean, you're already a pioneer and forging the way in what you're doing. What do you personally hope to leave behind as your legacy? And I know you have so much more time left and so much to discover and so much more to do, but at this moment in time.
I would like to make a difference.
Mhm.
I would like really to be change in people's life, patient's life, chronic pain patient life. It's quite satisfying when I see a patient that was treated for pain and went back to work or went back to his family or whatnot. That actually truly way more than money, business, or anything else. Just making a difference, just making the world a better place than what we live in right now. You know what I mean? It's quite important for me personally and for my kids
Yeah,
um, to do that because I don't believe that we were um, found in this earth just to live, sleep, work, and die. I think we just need to make a difference, and everybody's got a purpose. So,
absolutely. Yeah, a divine purpose. You know, I believe we were all sort of created with unique gifts and talents that are inborn, you know, God-given,
yeah,
and our purpose is aligned with utilizing those gifts and talents to their fullest potential for the greater good.
yes,
You know? So that's incredible. And I love how you said, you know, always be learning because it's so true. Like Earth is like God's school of life for all of us. And we have to continually be learning and growing so that we can make a greater impact for the greater good, you know, and that
yeah.
involves our spiritual growth. And it's just important. So, do you have a client case that is very memorable to you that you could share with us? Something that was just wow, that really moved you in the transformation of the patient that you experienced?
Absolutely. I had a patient that we became friends, and he was a Canadian inventor, so he can invent stuff.
Wow.
Uh, Unbelievable. And then slowly, he got deteriorating, and the spine hurts, and then he stopped walking, he stopped moving his arms, and we couldn't do much for him in the Canadian system. So he looked around, found Laser Spine Institute, and asked me if I will take a Skype. So that tell you how long ago that was. There was no
Yeah.
Zoom or a Teams meeting. So anyway, so I did that call with him. He left and went to Florida, to Tampa, had his surgery, and he walked back into the clinic to see me a
Wow.
week later.
A week later, that's
Yeah,
incredible.
it is. It is. So that impacted me. I couldn't believe it. It was really an emotional moment. And I said, I need that for more of my patients.
You know, I believe doctors, in a way, are like the Lord's hands in the earth because, you know, it is miraculous when you heal somebody from a condition that is perceivably unhealable, you know?
Yeah,
So it's incredible. Congratulations. I honor you for what you do. It's a
I really
beautiful
appreciate it.
work. Now, what qualities do you believe are essential for building a strong, resilient, and successful healthcare business?
Um, Discipline is number one. You need discipline. You need purpose. You need to be purposeful and intentional because you're dealing with patients' lives. So whether you're making a business decision or a medical decision, you need to be intentional and purposeful. Why and why are you doing this? And keep your eyes on the goal. Visionary as well. Like I always say, you need to know where the medical field is coming from, where it is now, but what it could be in the future, right? In 5 years, 10 years, 15 years, right? Some patients, I will tell them, just wait. There are new technology coming. You don't need to do this surgery. You don't need to do this procedure. Just wait, right?
Yeah.
So to be a visionary is very important for the business and the medical side as well. So I think those are the best quality, but you have to keep your mind open for learning as well.
Right.
Learning is important for business as well as medicine. I learned it from medicine because we have to keep ourselves up to date all the time. But it's also for a business, it's fascinating, right? Coming from the medical side, I have my hands on the pulse, like I say. I know what patient needs, what they're suffering, and whatnot. And to apply this to the business side and shift or pivot the company to help the patient more is quite incredible. So learning is a good key. Some people thinks that some executive thinks that once you come to the executive side or to the executive level, you slow down. It's not slowing down. It's actually like I always say, it's a responsibility.
Right.
It's not a privilege. I'm responsible for 350 employees and 55 physician. Right? If I make any mistakes, they're not gonna have a job tomorrow.
Yeah, and all the patients that they
And all
treat.
the patients, yes,
Absolutely.
yes, and you can imagine the void that we will leave in the chronic patient lives and their treatments.
So where can patients find you? How can they reach you? How can they be treated by you? Do you have a website? Do you have books? Have you written books?
No, not yet. I'm
Not
working
yet.
on one though. Yeah,
Okay. But
yeah.
how do they find you? How can they be treated by you or your facilities?
I have my own website, drdemian.com, but I
Okay.
have my Instagram as well, Dr. Hany Demian,
Okay.
Facebook, LinkedIn, Dr. Hany Demian as well. We have a Biospine website and social media and pain care clinics, and we are 24/7, and we are
Wow.
very responsive. And if there is any medical question, I'd like to answer them myself,
Okay.
right? So it is very important to me to be connected with the patients, with anybody has a question that we can help.
Beautiful. Is there anything else that you would like to add or feel is important to share before we wrap up our conversation?
It's been a pleasure, and I really appreciate it, and I appreciate having me.
Well, again, I am honored to be able to spend some time with you today. You are an incredible doctor, entrepreneur, business leader. The work you are doing in the healthcare industry, in the medical field, and in the lives of so many people who need you and what you're doing in the world. I just commend you, and may the good Lord continue to bless you and all the work of your hands and your business growth, across the nation. And thank you for coming on and for spending some time with us today and sharing your incredible insights and experience with us.
I really appreciate it.
God bless you.
Thanks a
Thank you
lot.
so
Thank
much.
you.
Bye.
Have a great day.
You
Bye.
too. Okay, did Cindy leave? She's gone. All right.
Yeah, she probably.
Well, again, it was such an awesome interview. I wish you all the best.
It's a pleasure.
Yeah.
It's a pleasure.
Thank you so much.
Thanks a lot. Thank
Take
you.
care.
Bye.
Bye-bye.